Good afternoon, everyone. Welcome to Patient Navigation and Support during a breast cancer diagnosis. Thank you so much for joining us this afternoon. My name is Angela Papalia. I'm the Assistant Director of the Adelphi, New York Statewide Breast Cancer Hotline and Support Program, and I'm a bilingual social worker. It's a pleasure to have you all here today. And the Adelphi Breast Cancer Program is so happy to have you here and to be joined by our community partners. This special program is a collaboration with Northwell Health as well as the Friedman Center. And we have partnerships across Long Island and New York. So if you take a look in your chat today, you will see additional contact information for how you could reach our programs. I'm pleased to share with you that we have an expert panel here this afternoon. And one of the things that we feel very strongly about at the Adelphi New York State Breast Cancer Program is bringing experts here to you. It's really important to have those intimate conversations with members of your treatment team when you're going through a breast cancer diagnosis, because as we all know, a diagnosis affects every single member of a family, and it can be a very overwhelming journey. One of the things that we want to share with you today is that you are not alone. Wherever you may be in your breast cancer diagnosis or treatment plan, there's always someone to reach out to. There's always someone to listen and to provide valuable insight, support, navigation, education, and referrals. The Adelphi program has been serving New York State for over 44 years. And we have partnerships across Long Island and across New York State. And you will meet some of our esteemed colleagues in the community this morning. And one of the things that we want to share with you is how you can reach out to community social workers such as ours at the program, also to nurse navigators at your cancer centers of excellence, as well as your breast surgeon and other members of your treatment team. So we're very lucky and privileged to have 3 experts in their respective fields today. We're going to start with Dr. Susan Pileshi. And Dr. Pileshi is the Director of Breast Surgery at Glen Cove Hospital. She is a breast surgeon specialist with over 25 years of experience. And she's going to talk about how you can utilize your breast surgeon throughout your journey to help advocate, to provide support, information, and medical guidance throughout your diagnosis. And this will be an opportunity for us to hear firsthand from the experts. At the end of the panelists, you'll have an opportunity to enter questions into the chat. And if we have time, I'll be able to moderate and present those questions to our speakers. So without further ado, I'm going to turn it over to Dr. Pileshi. I think we're experiencing a technical difficulty, so we'll just wait just a moment. And while she's linking into the audio, for those of you that may not be familiar with all of the comprehensive services at both Northwell and also with the Friedman Center for Breast and Lymphatic Surgery and Adelphi, there are a variety of support services available at all 3 partners. So please take some time after today to explore our websites and to take a look at what's available at your fingertips. Good morning,
Hi.
Dr. Pileshi. Welcome.
Hi, and thank you so much for having me. I do apologize. I had some technical issues. So I thought that it would be helpful to start by describing the typical journey of a breast cancer patient as we talk about patient navigation and support during the breast cancer diagnosis. And then we can incorporate the resources that we have through the Northwell Breast Navigation System as well as Adelphi. And I really would like to thank you for asking me to participate in today's program. So upon the diagnosis of breast cancer, which is usually made after a breast cord needle biopsy performed by radiology, the patient is typically referred to a breast surgeon first, as most patients will undergo breast surgery first as part of their treatment. Once the patient is referred to me, either by their primary care physician or gynecologist, or I should add, if the patient had their biopsy through Northwell breast imaging, then the patient can be referred to a breast surgeon through the Northwell breast nurse navigators. And the breast nurse navigators will help the patient to make an appointment with one of our breast surgeons here at Northwell. And I'm sure Jacqueline and Elizabeth will, two of our breast nurse navigators participating in the program today, will further elaborate on their role during our presentation today. So during the consultation with me as the breast surgeon, which usually takes 1 to 2 hours, I provide a comprehensive review of the radiology and pathology results, perform a detailed breast examination, and have a comprehensive discussion with the patient and her family regarding surgical treatment options and anticipated adjuvant therapy, which may include radiation, chemotherapy, and anti-hormonal medication. Additional services may be required depending on the specifics of the patient's situation. So sometimes patients need additional services such as genetic testing or fertility evaluation and preservation. And certainly throughout the consultation, of course, we provide emotional support and we optimize a plan for their breast cancer care. So following the consultation with the patient, I will then reach out to the Northwell breast nurse navigators to have them help with any additional appointments that may need to be made. So sometimes patients after the consultation may need additional testing, such as a breast MRI, or maybe they've already had their MRI and they need additional biopsies. And or they might need an evaluation for fertility or genetic counseling or other services. So at that point, after the consultation, I reach out to Jacqueline and Elizabeth and the other breast navigators. Once the workup is complete, then the surgery is scheduled and performed. And then after surgery at the postoperative visit, I review the pathology with the patient and her family, and then we develop a plan for postoperative care, which often means meeting with specialists such as medical oncology and radiation oncology. And once again, I can contact the breast navigation team, who will then help the patient to schedule and coordinate these appointments. And really, the Northwell Breast Navigation Program is such an incredible program. Jacqueline, Elizabeth, and their colleagues really provide outstanding service and timely communication with the patient, as well as with me as the referring physician. And beyond coordinating the patient appointments, they serve as a valuable resource of information support to the patient. So in the overwhelming storm, they provide a calm and reassurance to our breast cancer patients, and in doing so, the patient can better focus on their breast cancer treatment.
Thank you so much, Dr. Pileshi. That really provided such great framework with respect to how a patient can rely on their breast surgeon and the comprehensive team services offered at Northwell Health. So often patients will reach out to our statewide hotline or our staff social workers for support services. And it's so overwhelming, obviously, when someone gets a diagnosis. And it's wonderful for us to be able to say, encourage our patients and their families to go back to the breast surgeon and ask about these critical services, because so often, as we know, when you're in an appointment, it's a whirlwind. There's so much information. You're provided with folders, so many subsequent appointments after that initial consultation, and then it's at home, typically in the middle of the night, when people start to remember, oh, what about this? Oh, I forgot about that question. I really want to know about this. What would you say to a patient that reaches out to your office and really is a bit overwhelmed? They just met with you, say, the day prior. They're trying to kind of navigate, negotiate all the paperwork and the next steps after their meeting with you. How would you encourage them to proceed after your meeting? Are you the physician? Would you then reach out directly to the nurse navigator? Do you encourage patients to call directly? What would the preference be?
We certainly try to allow the patient to focus on their breast cancer care in terms of their treatment and decision making, to empower them to make the best decisions for themselves. So we try to take the stress of the appointments and coordinating all of the appointments in their care off of their shoulders. And that's why it's so valuable to have the breast navigation program. So I reach out to the breast navigation team after I meet with the patient. I send them an email. I say, I just met with Mrs. Smith. This is her diagnosis. These are the resources that she needs or appointments that she needs, and they will help to set up those appointments. And so this way, then, if the patient has any clinical questions about their diagnosis or next steps in terms of their treatment plan, they certainly can always reach out to me as the clinical provider. But there are times where sometimes Jacqueline and Elizabeth will reach out to me and say, Mrs. Smith had a question, she was questioning this or that, so that the communication really is important, and truly coordinating the patient care. And so sometimes they are then an extra resource for the patient to reach out to, since they've made contact with the patient, and they can reach back out to me and say, Mrs. Smith had a particular question, and that'll alert me, certainly to contact the patient if she hasn't contacted me independently.
Thank you for clarifying. It's such a wonderful continuum of care, because it's a wraparound service, and it's so critical, especially in the beginning when somebody has just started their journey. And it's really wonderful because we have such great working relationships with our partners at Northwell, to be able then to offer to patients with the nurse navigators and the social workers at the program. We have a matching service where we could actually, through the team, match the patients with a survivor that's professionally trained and supervised. And that woman could actually speak with someone directly who's had that type of surgery that she perhaps is contemplating, or that treatment regimen that she's moving forward towards going through. So I think, go ahead, I'm sorry.
No, I was just saying that patient-to-patient connection is so important, and I really appreciate your team coordinating that, because it's one thing for us as providers to anticipate what the patient might experience going through a certain treatment or procedure, but when they hear it from someone else who's already gone through that, and they can see that she successfully went through it and she's on the other side of things, it provides such a source of information and reassurance to the patient. So we really appreciate your ability to do so.
No, thank you. I couldn't agree more. I think that's wonderful. And, it's so easy to reach yourself and members of the treatment team at Northwell. And I know I had alluded to it earlier in the program, but for those of you that perhaps just joined us, please take a look at the chat during the program, because the listing information is right there, how to reach the Adelphi program, as well as a cancer care navigator. And you'll have the chance to meet some of our very esteemed colleagues, our experts who are breast nurse navigators at Northwell Health, and they are always there for the patient. So it's really just a wonderful service. And thank you so much for providing that information, Dr. Paleshi. I appreciate you. Thank you. So at this time, I'm actually going to do a brief intro with our colleagues as part of the nurse navigating team. We are joined here today by Jacqueline Barber and Elizabeth Dowling, two exceptional seasoned nurse navigators who have been a part of Northwell Health for many years. And they're at the Cancer Institute and very reachable. As you can see in the chat, their information is there. And this service, as part of Northwell Health Cancer Institutes, when the Cancer Care Navigation Team was first created, it provided such a vital link in the community for breast cancer patients and their families. So without further ado, I'm going to turn it over to this dynamic duo. And if you would be willing to share, Jackie and Elizabeth, welcome, some of what your day is like working with patients, and take us through your role as the nurse navigators at Northwell Health.
Of course. Thank you so much for having us.
Yes. One of the things that I wanted to help people understand is we are here for the patients from the point where they've had their biopsy and they have their diagnosis all the way through to survivorship. So you're paired with a navigator throughout your entire cancer journey. We will contact the patient directly. After that, patients have our direct line. Mm-hmm. We're always available. We will work with the surgeons. We will work with imaging. We will work with any other specialties that the patient needs to see. One of the things that I think is very important, and it was touched on earlier, is right after a diagnosis, patients get very frustrated or confused or nervous. I always say, get a notebook, start writing down your questions now before you even go see the surgeon. And then they can always ask the questions at that time. If they forget, they can always call us. I've been through cancer myself, and I know that, it's frightening. You don't know how to get in touch with anyone. You don't know what you're supposed to do. That's what we are here for. Mm-hmm. We want to connect you with the doctors that you need to see, when you need to see them, all of your appointments. If you need imaging, we'll explain what the process is. A lot of patients don't understand what a breast MRI is. We'll walk them through it, explain how it's done. What else do you?
Yeah, I mean, we like to be the first point of contact, so that patients know that they have someone to call. Mm-hmm. And I always say, because there's so much information, there's so many people, there's so many phone numbers, that it can get overwhelming. And what I like to tell patients that I navigate is, if you're not sure who to call about a question or a concern or just a comment, sometimes you can always call us. And if we don't know the answer or who the correct contact person is for that issue at that exact moment, we will do the research. We will find out who to send you to. That way there's a little less stress on your shoulders as a patient, because you have enough going on. Let us handle some of that weight. And as Jackie said, you have our direct phone numbers. It's not, a line where there's an extension. You're not going to be put on hold until somebody answers the phone after 10 minutes. It'll either be us picking up the phone or our direct voicemail, and we try to get back to patients as soon as possible if we're not able to take a call at that moment. So that's why I love being a breast nurse navigator, is because I definitely feel like we make a difference every day. Mm-hmm. When patients say, I went to the doctor, or I need to see the doctor, I'm not sure where to start, I don't know who to call, how do I do this? Do I just go into Google? And we kind of say,
never Google.
Never Google. First of all, Wikipedia is not very good with that.
No. Dr. Google is not good.
Not recommended. Yes. But I just say, listen, let us take the reins a little bit. If you allow us to help you, we will. And then throughout the journey, every situation is different. I have patients who like to email me updates every week or so, just to let me know what's been going on. Hey, I may need help with this. Can you give me a call later this week? Absolutely, no problem. I have patients who like check-ins every month or so. So I'll call them and I say, hey, I heard that you started this treatment, or I heard that you saw this physician. How did everything go? Do you have questions? Are you concerned about anything? Did you like the staff? Were they, accommodable to you? Things like that. And I have other patients that say, you know what? You've helped me so much. I'm going to call you when I need you in the future, but I still have your number, and I'm glad that I have your number. So it really is what you make of it. And we're happy to oblige in any way possible, as long as it makes you as the patient feel comfortable and safe and confident in your care team. That's our goal as nurse navigators.
One of the things I love about doing this is we actually form a relationship with the patients. Sometimes patients just call to say, hey, guess what? This happened today, or that happened today. Sometimes they're having a bad day and they just need somebody to talk to who's going to listen and not tell them what they think that they want to hear. We'll just listen. And, I think that's so important, because we understand the process. We understand the stress and the pressure of it. So if we can take any of that pressure off, I think it's a great thing.
Mm-hmm, absolutely.
Mm-hmm.
One of the things that you had touched upon, ladies, and it's just, there's so much to work with, because what you do is so critical, and it really helps to ensure a seamless, movement throughout someone's diagnosis. But I think it's really wonderful that you are their point person when a patient first enters this new chapter of their lives, to be able to say, I have these incredible experts. I have nurse navigators who, if I don't know who to go to, there's never a wrong question. There's no such thing as a ridiculous question. And there's always somebody to reach out to. And you are that really critical initial point of contact. it's so wonderful because you're so accessible. And that's very reassuring and something that we hear from people across the state because you feel like there's that saying that you could feel absolutely alone, even though you're surrounded by hundreds of people, and
Mhm.
I think a lot of times patients experience that. So to be able to have your information, your number, your faces, those kind words, and, that patient ear that's always waiting to listen and ready to help. It's just such an important service. And we know for a fact at the Adelphi program that the nurse navigators are really instrumental in also referring out to other complementary services, be it social workers, other therapists that are critical during a cancer patient's treatment journey, whether it's concrete services. I know over the years, our staff social workers have interfaced with nurse navigators because perhaps there's transportation barriers. So community social workers will pair up with the Northwell social workers in radiation oncology, in the infusion clinics, on the floors, to really
Mhm.
provide that complementary service of, okay, we could provide emergency food cards, you can provide emergency transportation, and it really is that continuum of care. That theme continues throughout a patient's journey at Northwell. And so we really thank you for that because it's so wonderful and so important because if people don't feel joined in this experience, it's less likely for someone to be able to follow through with the necessary pieces of their critical treatment.
Yes.
And as we know, Northwell, where you reside, where you live at the moment, you're the Queens Nassau border, and our offices are physically located in Garden City. However, all of our institutions, our partnering institutions, Northwell, the Friedman Center, and Adelphi, we have satellites and services across the state. And I think that's really important for patients and their family to recognize as well, because things change. But also, one thing I wanted to ask, if patients are being seen at your office, at your institution, and this is something that a lot of people don't realize and we talk about a lot in counseling, is that even if you haven't met other licensed professionals that are part of the Northwell system, but perhaps somebody's talking about with a friend about lymphedema treatment, about social work services, can you speak to the fact that once you're a patient at Northwell, you're entitled to all of the services, all of the professionals within that institution? Because there's a lot of confusion about that. People just don't know.
Yeah, so part of our job as navigators when we check in with patients after a visit or even every few weeks or a month, depending on what the patient likes, sometimes during that conversation, a comment comes up and we think, oh, you know what, you actually might benefit from seeing somebody in a center that helps stress management with maybe
Mhm.
some Reiki or acupressure.
Yes.
Hey, you know what, if you're having a bit of swelling going on, we have offices that help treat any type of lymphedema or prevention of lymphedema.
Mhm.
So when you're navigated and when you're a Northwell patient, you 100% have the right to see everybody that'll help you in your continuum of care. And that's why we like to check in with our patients, even if it's been a while, because there could be something that maybe a patient isn't comfortable talking to a physician with, but maybe since they know us for a longer time, they say, hey, you know what? I've been having these symptoms. I've been feeling this way. I need to speak to somebody. Is there anyone I can reach out to? Any services that you can provide? And as I said before, if it's a request where I'm thinking, I'm not sure if I have anyone like in the back of my mind, but let me see. I can go to Jackie. I can go to Sadana, who's another breast nurse navigator we work with. They might have a connection
Right.
in your direct area that I may not know of yet. So it's a constant learning curve.
Yes.
And that's what's lovely, is that a lot of times we learn and grow together. But absolutely, patients have the right to be connected to any service that they think they may need and benefit from. And we can help do that.
We're also in contact with the entire care team.
Right.
So if our patient is referred to us from Dr. Paleshi post-surgery, and she says, a patient might benefit from cancer rehab or for lymphedema treatment, we'll make those connections for the patient. And what we like to do is we really like to get our patients connected very quickly. Why should anybody have to wait? So we do it as quickly as possible. And we're always in contact with the patient and the team. So anything else that comes up, you know, if there's somebody else that has another request, or they saw the patient and they think that maybe the patient does need to speak with somebody, that, you know, they're having trouble emotionally, we can make that connection right away. So it really, for us, we really love the fact that there are so many connections in the health system and so many services. I myself manage a grant for patients for transportation or for food cards, things like that. So there's always something that they can be connected to. No one's out there alone. And when you need something specific, we find where you need to go. And I think just having services available to a patient and not having them try to look for it themselves, I think, again, it takes so much off of their plate so they can focus on healing and getting through their disease process.
Yeah. Well said. It really does take a village, and you're very much a part of that village, you know. And I certainly could speak out of personal experience in terms of, you know, working so seamlessly with both of you as well as other members of your nurse navigation teams, because when our staff social workers have reached out in the past, you know, it's such a beautiful relationship because everybody has this all hands on deck mentality, from the community to the health system, and we all complement one another in terms of the services that we could provide to patients and their families. And it's really incredible because we're very fortunate in New York to have so many resources at our fingertips, but even more so that these close working relationships are in existence, because there's just such a mutual respect. And it's just a beautiful system that really is that wraparound system for patients. You know, it's interesting because a lot of times patients will say, through counseling, or if they find our hotline number and they're referred to social work, they say, well, I have a social worker at the hospital, or I have a navigator, but I'm not sure. Can I still talk to you? And we always say, you know, in terms of services, the more the merrier, because we're all here for you. And this is not about any of us as individuals, but rather the VIP on the treatment team, which is the patient ultimately. And we always reiterate that the patient is the most valuable person on part of that team. And we're all here, I like to say, as accessories to help support and empower that patient. And that's really our mission. So I so appreciate you taking us through that journey of when a patient interfaces with the healthcare system and really has an opportunity to be a part of the nurse navigation team and take advantage of all that's to offer. Because no one should feel that they don't have a place to go with their concerns, their fears. You know, and Jackie, you said before that Dr. Google, it's a dangerous thing. So definitely don't go on Google. We encourage people always use your nurse navigators, use your treatment team, call the hotline, call a social worker, and don't be afraid to ask. You know, because there's always somebody that's there. That's something that we can't say enough, I believe, as professionals. Don't be afraid to just put it out there. There's no ridiculous questions, and don't be afraid of offending someone. If you had a conversation with a member of your healthcare team and you didn't get an answer that really you were comfortable with or you didn't understand, would you say the same for patients? Like, don't be afraid to keep at it and call, reach out.
Yeah, absolutely. There's been, you know, situations where a patient might want to reach out to a therapist of sorts, and I would give them contact information, maybe, you know, set them up with an appointment, and then, you know, something may change. They may change their mind about seeing somebody, or may want to see someone else, and they were afraid to let me know because I helped set up that appointment. I'm not hurt by that at all.
No.
You are the center of this whole world that we're in right now. So if you need to do what's best for you, that's totally fine. And you can always let us know if additional needs or concerns come up. We can 100% help you. You know, even if you want to see another provider for a second opinion within Northwell, no one's going to hold that against you. Because at the end of the day, you are the one that needs to be, as I said, comfortable, confident, feel safe in your care, and feel comfortable going forward. Nobody can really do that and decide that, except for you with us as additional support, of course. So there's never going to be anyone going, oh, well, I wanted her to see this one, but it doesn't matter.
Yeah.
We're here to help you, whatever that means. We'll do it for you, and we'll be a source of guidance and support no matter what.
One of the things that I always make a point of saying to patients as women, we normally put ourselves last.
Yes.
And I explain to them that this is the first time that it's in your life that it's really going to be okay to put yourself as the priority. You know, everything is about you right now. You know, if you're not happy with a particular provider, that's okay. Like Liz said, we'll change it. If you feel that you need something, if you need services or things like that, and the family keeps saying, no, yes, whatever you need, we'll do for you. We really try very hard to make sure the patient has everything they need. And even if it's explaining processes, or we know the doctors. So a lot of times they'll ask us questions about the doctors before they go and say, I'm a little nervous, you know, what is this, who's this doctor? What's their personality like? What can I expect when I go to the appointment? So these are all the things that they might want to ask, like you said, and we're able to give them all the information they need, and no question is ridiculous. It's always about them and what they need to help them get through this whole process.
That's incredible. It's just, I think, so reassuring to hear that directly from the care team. So I thank you both so much. Dr. Palashi, I want to just draw you into the conversation. Is there anything that you would like to add that the nurse navigators had touched upon during their talk?
I just wanted to, again, just emphasize just how vital their role is in the patient care. And I really love the fact that at Northwell, we truly are a collaborative team in coordinating all of the different resources available to the patient. You know, I always have great confidence that anywhere within the Northwell system, the patient will be very well taken care of, whether it's with me or with another breast provider or with our radiation or medical oncologist. So that really great collaboration and communication is so important. And I've worked in other systems, other private practice systems where there wasn't a nurse navigating program. And the concern as a provider is I can lay the groundwork in terms of the plan for the patient during the consultation, but it's a very overwhelming process naturally for the patient. And it gives me great confidence to know that they'll be able to follow through with the direction of the breast navigators to make whatever appointments they need to make, and that there's another a resource for them and support to really make sure that the patient's care is as seamless as possible. So I couldn't do what I do and be able to take as best care of my patients without them. So I really appreciate their support and their vital participation in our patients' care.
Thank you so much for that.
Thank you. Right back at you.
Yes.
You know, and I think it's so really wonderful to see for patients this beautiful relationship between the providers, because so often it's so intimidating and overwhelming to have forums such as this where patients have access, you know, in real time to physicians, to nurse navigators and other professionals. I think it's really important. And for everyone out there on this call to remember that we're all here to help you. There's always somebody here to address whatever needs you may have. There's nothing too big or too small that we're not willing and able to tackle. And I think that's really important to remember. So I haven't seen any questions in the chat, but I'd like to offer that opportunity for a few moments to the public, that if you do have a question or something that really struck you during the presentation, please put it into the chat and I will moderate it and address the appropriate person on the panel. While we're waiting for people to do that, this question is for the whole team. For someone that may be listening today that is seeking care, perhaps they're in the beginning of their journey with a diagnosis, and they are receiving care at a center of excellence, but they're not finding their needs being met in the way that they had hoped to. What would you say to someone who's really struggling to find the right team of providers?
If they're at a Northwell facility?
No, I'm sorry.
Outside?
Outside of the Northwell Health System. They may be at another large cancer institute, a cancer center of excellence, or a small hospital where they started with their journey in terms of being diagnosed, but they're really trying to find the right fit. What would you say to somebody that's really in a difficult position right now in terms of seeking care that feels good for them?
Yeah, I mean, we do have patients call us with that concern. They may have seen a physician or a team at another outside facility and are just not really feeling 100% comfortable. So we also work with coordinators at Navigation. And what I usually say is we are happy to help get you an appointment to see a surgical oncologist or medical oncologist, whoever they need to see in Northwell. We would have to get of course, records from the previous provider so that our physicians are aware of the case. They have all the pertinent information so that when they meet you, they can give you the best recommendations possible based on the information at hand. So what I like to do is we will send out, usually via email, we can mail it if that's easier for patients too, a medical release form. We talk you through how to sign it, how to fill it out. You send it back to us. We send it to our coordinator. The coordinator is the one that works getting the medical records over into the Northwell system. So it's nothing that the patient has to do themselves, because that can be time consuming, of course. And then once everything is kind of rolling along, we can help get an appointment as soon as possible. And then also, we also can email patients pictures of the surgeons in that area. Sometimes patients like to do their own research. Sometimes patients like to see a face before they see them in person. So everyone is different with that. If anyone is questioning who they might want to see, they kind of want to do their own research first. I do like to send that information out to them just to say, hey, these are the surgeons or medical oncologists in your area. These are who I can refer you to. You want to do your own digging for a little bit? That's totally fine. Here are their faces and their names. Give me a call back. I'll check in with you maybe in a day or so. But we are able to get patients into the Northwell system pretty seamlessly. Yes.
And one thing I also wanted to say, because Liz brought up our coordinators, we have some amazing people. Our coordinators are fantastic at what they do. They're compassionate human beings. They know exactly what needs to be done for the patients, and they're the ones that are contacting the patient to make the appointment. They love the patients just as much as we do. They care just as much. I have actually one patient who calls to check in with our coordinator just because she likes her. So, it really, that's the thing. Our team works together so well, where we're always putting the patient first, but they will be working with our coordinators. And I wanted to give them a little shout out, because that is another group on our team.
Right. And then, Angela, I do want to add, when you talked about a patient trying to find the right fit, finding the right fit is so important, because my philosophy for all of our breast cancer patients, this is a long-term relationship. So it's important from the very beginning to try to find the right fit. And if at any point it's not the right fit with whatever provider they have, then the patient should potentially, speak to our navigators or look into additional resources, because it really truly is a lifelong relationship, and having the right fit gives the patient some great, reassurance and confidence in their care. And if something doesn't feel right, then we need to sort of encourage the patient to have us help them find the right fit and to find the more, a comfortable, circumstance for them. So, we really need to pay attention to that.
I very much appreciate you bringing that up, Dr. Paleshi. Thank you, because we couldn't agree with you more. And, Jackie and Liz, your passion and your empathy. It really comes through. And I love that you talked about the patient coordinator, because that person really is another really incredibly vital link in this whole process. So I appreciate that. And sometimes people are a bit confused, the difference between a navigator, a nurse navigator versus coordinator. So thank you for providing that clarity as well. Some questions have come up about support groups, and that's something that we provide at the Adelphi Breast Cancer Program. We have ongoing virtual support groups, but we also have in-person support groups. You know, the world has changed a great deal in the past few years, but we are offering some of our programs in person, and in the fall, we will be offering more of our support groups in person at the request of patients. At this time, we have a group for newly diagnosed patients. We have a group for people who are dealing with metastatic disease. We have a Spanish-speaking support group for survivors who are post-treatment. At the request of the community, we do run a group for patients who are newly diagnosed in Spanish as well within the past 18 months. And we do have a support group for women who are dealing with a recurrence. So it's very much formed. Our support group offerings are formed by the request of the community, and we're able to shape those groups based on need. They are closed groups, which means once you begin with your social worker, they're all professionally facilitated. There are no new members typically that join. There may be exceptions with some of the groups, but typically they run for between 6 to 8 weeks. And if anyone has any questions out there on the call today, please don't hesitate to call our hotline. You can send me an email directly, but they are ongoing groups and very comprehensive. We really try to see what the best fit is for each individual patient. And there is an intake process that people could just call our program and speak to a social worker to see what's best for you at this time. And we do have bilingual services. Something that we wanted to talk about also at Northwell, of course, there's multilingual services available, just like any other health system in the nation. That's really important because people do forget about that, but language access, is critical, and it is a right. So anytime someone interfaces with the medical system for any type of service, any type of treatment, Language Line is available at all facilities, as well as in-person translation. So I always like to bring that up because that's very important as well. Mm-hmm. And we do have someone who was asking specifically about Northwell. If there are multiple Northwell providers in the same specialty in an area, how do you choose which one to set up an appointment with? That's part one.
I like to ask the patient what they're looking for in a doctor. What if they want someone who's going to be a little softer, do a little more hand-holding, or if they want someone who is just going to, say, okay, this is the plan, this is what we're doing. That's one of the things that I ask, and I try to connect based on their preference or personality. But as Liz mentioned before, a lot of times we will send them a list of our physicians with their photograph. Mm-hmm. And patients do actually do the research themselves. They like to read up on them. The other thing is we know our surgeons about particular surgeons or medical oncologists or radiation oncologists. We know them. We work with them on a daily basis. So any questions they have, they can always ask. And then we let the patient make the decision. There are some people that just say, I don't care who it is. I want the earliest appointment. Mm-hmm. But then there's other people that want to really dive into a doctor's background or, read up on them a little bit more.
Mm-hmm. And also, as I said before, getting a second opinion. If you're not sure who you want to go with, you see one physician, but you also heard good things about this other one. Mm-hmm. And, that's still okay. We can help set up both appointments for you and then check in with you and see how you're feeling and go from there.
A lot of patients say, well, I want to see the best. They're all the best.
They are.
There's not one surgeon that we work with that I wouldn't refer my family to. Mm-hmm. It's just really what it comes down to then is personality, or even if it's a convenience, location wise. Yeah. We provide as much information as we can about our surgeons, and let the patients make their own decision.
Thank you for addressing that. And Dr. Pileshi, I know that you wanted to add to that.
Well, I just want to add in terms of a second opinion, it's not uncommon for patients to want to seek a second opinion, sometimes within our system and sometimes outside the system. And I'm just wanted to comment that from a specialist perspective or a physician perspective, we encourage that. We don't ever try to discourage that. We think it's important for the patient to obtain as much information as possible so that they can feel as informed and empowered to make the right decisions. That very first consultation, whether it's with me or with another provider, is extremely overwhelming. They're probably only absorbing half of what we say, and certainly we provide written information and diagrams and resources to the patient. But there's only so much in the setting of a newly diagnosed breast cancer setting where they can absorb only so much. So sometimes seeing that second opinion, they're going to be hearing that information a second time, maybe even presented in a slightly different way, depending on the style of the other specialist. And it really helps to reinforce their knowledge base, which ultimately empowers them to make the right decision. And so if I see a patient, they go elsewhere for a second opinion, they come back to me, I'm never offended. If anything, it's a compliment to say, okay, they were indeed comfortable with what I had to, say. And if for any reason they choose to go elsewhere, then I just, acknowledge that, they need to find the best fit for whatever reason, whether it's location or sometimes family members, have a relationship with a different physician. But just the point is that we always do encourage second opinions. We think that it's valuable, and we, respect the patient's desire to do so.
Thank you, everyone, for addressing that. That's such an important question that was brought up, and wonderful points. And as you're talking, I'm thinking about some of the support groups and some of the issues that come up. One of the things in the group for young women who are under 40, we always encourage our patients to, when they look at any type of provider, see what that specialty area is, because especially at Northwell, there's so many experts in their respective fields, and there may be certain differences that may be more appealing for one provider versus another when a patient is seeking care initially. Perhaps there's a focus on young women. One of the physicians has research in that particular area. We know for a fact that at Northwell Health, there is a center for patients who were diagnosed with breast cancer while pregnant. There are physicians devoted to that. There are so many specific niches for specific diagnosis and different categories of this disease that's so comprehensive. And as you're addressing all of these questions and articulating how much the health system has to offer, I think it can be very reassuring to patients on this call to hear that there is a wealth of information out there. And if you would like some support in navigating that process, you are supported at every turn, from the nurse navigators to the doctors to social work to the community groups out there, and an opportunity to connect with patients who have been there. Again, our peer-to-peer program and having the opportunity for patients to be matched very specifically with somebody who's been where you are, that's such a valuable resource every step of the way, whether it's getting that second opinion, finding the right provider, deciding which treatment regimen is right for you, etc. So I think it's really wonderful that we can showcase all of these options. Thank you. And somebody had also put in regarding the issue of navigating insurance, questions about coverage. I know from a social work perspective, that's certainly something that we deal with all the time, but within the Northwell system, would you like to speak to that, Jackie and Liz?
So for insurance questions, we definitely work with social work. We also have an authorization team that we can reach out to, as well as financial services. If there is, and also I will point out this as well, when we are connecting with a patient and our coordinators working on getting you an appointment, they will make sure that the insurance is compatible with that physician. So there are check marks along the way, but any other additional questions with insurance or finances, we have teams that we can help connect the patient to and fast track a response from them.
Thank you for clarifying that. And something that we deal with at the program all the time across the state is Patients that perhaps don't have insurance for whatever reason, or perhaps they find themselves underinsured. That's a big issue as well. Somebody that's uninsured, perhaps they lost their job, they lost their insurance plan, things changed in their financial situation, or if somebody is underinsured. Those are the types of issues that you can certainly call our program with, because our seasoned social workers are able to navigate you through your very specific situation. And typically what we end up doing is helping you to connect with your providers, but there are all a variety of resources across New York State for anyone that has been diagnosed with breast cancer or any other type of cancer. Very specific programs through the New York State Department of Health that allow people access to emergency Medicaid and other types of financial programs to help ensure that anyone going through a cancer diagnosis receives the care that they so rightfully deserve. So we always like to highlight that too when we talk about insurance coverage or lack thereof. To not be afraid to bring those important questions up, because the more we know as the professionals, the better off we're able to assist you into addressing those challenges.
Yes.
Right. Does anyone else from the audience have a question before we part ways with this esteemed panel, who I can't thank you enough, all three of you, Dr. Pileshi, Jacqueline, and Liz, for offering your time amidst your very busy day helping patients, but also for your expertise and willingness to just really be open with us and helping us understand how you assist patients and their families every day. I'm going to give our audience one last chance. Any final thoughts from our panelists that you'd like to share with the group?
Angela, I really want to thank you and certainly my co-participants for this incredible program and highlighting so many of the important issues in terms of navigating our patients through their breast cancer diagnosis, because it truly is an overwhelming process. And we work so well, all of us together, that it really makes a huge difference in the care of our patients and the success of their treatment.
Yes.
Well said. Great. Thank you so much, Dr. Pileshi. I so appreciate your time. Liz and Jackie, thank you so much. I echo Dr. Pileshi's sentiments. And certainly, if anyone here on the call today would like to access our panelists, please do so. You have the information in the chat, but you also will be receiving an email from the Adelphi program, and all of the contact information will be listed in there as well. So again, thank you, ladies, so much for your time, and we appreciate everything you do on behalf of the community.
Thank you.
Thank you.
And thank you for everyone who joined us today.
Yes, thanks for listening.
Yes.
That concludes our program, everyone. I wish you a peaceful day and enjoy some sunshine. Thanks
All right.
again. Okay, bye-bye.